So hi everyone, my name is Colin. I'm a postdoctoral research fellow here. So I work, as Maria said, on this project, tracking where UOW graduates end up working with David, Lyndall, Rowena, Judy, Kylie, and Andrew, who are lovely people, and many of them are here today. I'll just say, to follow Andrew is a tough gig, but he certainly does practice what he preaches, so I think it's been fun working for them. So before we sort of talk about Wollongong, we might talk about rural health workforce generally, and I know this is familiar territory to a lot of people, but to some people it might not be. When we talk about rural workforce in Australia at the sort of the really broadest possible level, we're talking about the modified Monash regions, right? So 7 different regions, and they're determined about how far the region is from a major metropolitan area. So on the right there, you can see the 7 different regions. So everything from major metropolitan areas, so Sydney, but also Wollongong, all the way down to very remote communities. Now, if you have a look at the map of Australia there, you might think, oh, that's quite a lot of green, that's quite a lot of metropolitan, but that's actually already MM5. So when you see that big band of green, that's already small rural towns. If you're looking for the metropolitan regions in New South Wales, they are tiny, tiny, tiny regions. So although these MM2 to 7 regions, like geographically they cover most of Australia, but in terms of population, it's about 30% of Australia's population, but only about 20% of Australia's doctors. So you can immediately see there's going to be a problem. And only about 18 to 20% of Australia's medical graduates. So it only gets a little bit worse, I guess. So if you're interested, there's Nowra there, and Wollongong and Sydney. So you can see most of New South Wales people live in this light green area. It's really quite small. So outside of areas like Sydney, so in regions we call MM2 to 7, which is a really broad brush way of breaking up Australia, but anyway, it's what we're doing. You can see that they're generally poor health outcomes, no surprise to anyone in this audience. There's lots of reasons for that. We're going to talk about workforce today, so we're going to talk about staff recruitment and staff retention and just balancing staff numbers out, so that's the focus. Because there are real problems getting people to work in these regions. People, for whatever reason, don't really want to. This is just hard to change. There's been a lot of things that have been tried by the government with mixed success, it has to be said. So sometimes they sort of work, but nothing is doing an amazing job, unfortunately. So unsurprisingly, one of the major players in getting doctors, particularly, to work in regional areas is the medical schools. So Wollongong's Graduate School of Medicine, and I work in the building next door here. Unsurprisingly, hopefully to all of you, it's about training doctors to work in these regions, in these MM2 to 7 regions, encouraging doctors to work outside of the cities, right? So the stated aim is training graduates with the capacity and desire to work in regional, rural, and remote communities, so MM2 to 7 regions. Certainly had some success, so that picture there on the left are some doctors who came from the first cohort from Wollongong Uni, and at least at the time of this photo, were working in the hospital right around the corner as specialists. So good result there. But the question is, what about everybody else? You know, we have had maybe 1,000 graduates through the uni. Where is everyone working? This is quite a hard question to answer. So we're talking about tracking graduates because it's not just about where they're working this year, it's about where they work next year, it's about where they work on specialists, as interns, and so on. So it's a longitudinal problem. Luckily for us, data is collected on this by AHPRA. So for those of us who aren't medical professionals, it's Australian Health Practitioner Regulatory Agency. The majority of health professionals in Australia have to register with AHPRA every year, so that's helpful. But what's really helpful to our cause is they have to put where they are working. So are they working in terms of postcode, in terms of suburb, which we can convert to an MM region, right? So we can say, well, this person worked in MM1 in this year. Next year we get a different data set and we say, well, they've moved to an MM2 region or whatever it is. So we can use this to track our graduates. So here I have a graph, sort of putting some of this data together, just looking at people working in MM2 to 7 regions. So on the x-axis, the horizontal axis there, we have over postgraduate year. So from graduation, years from graduation, starting off with sort of interns and residents. People may enter a training program, they may become specialists. And that might impact where they work. They might find those opportunities are more available in an MM1 region, so they move to an MM1 region, or not. On the y-axis, so what we're measuring here is the percentage of each graduating cohort that's working in an MM2 to 7 region. So if we have 100 graduates and in their first year out of university, 30% are in an MM2 to 7 region, we'll see that, and so on through their careers. And for our purposes, the higher the number, the better. If we could get that to 100, happy days. But probably looking more about 18 to 20%, that's the national average. That's the bar that Wollongong would be looking to beat. So the good news is we do. If you put all our data on there, and there's a couple of things to talk about in this data set, it's a bit messy in some ways, but I think the overall message there is that we do beat that bar, which is great. This is an incomplete data set. We don't have postgraduate data for every cohort for every year. We don't have that yet. We will have that at some point, which means that some of this data is about the cohort rather about their point in time. You can see there's quite a lot of variation there, I think. So this cohort is 7 years out from graduation from Wollongong Uni, and this cohort is 7 years out from graduation from the same uni, and the difference is enormous. So this bottom cohort, only 20% are working in an MM 2 to 7 region, still pretty good. And that top cohort, 35%, so really fantastic. Which makes this data a little bit hard to interpret in terms of where we sit, where we land. But I think we can kind of say 25 to 30% of Wollongong graduates are working in MM 2 to 7 regions, which is good news. And this appears to be consistent over career, I think, which I found surprising and quite interesting. I thought the number would go up or go down, but it doesn't really seem to change. So if you want a simpler graph, and I think a lot of us do, I've animated that. So that's just the mean traveling over time of all those different cohorts. And what we see is, yeah, it bounces around a little bit, probably because we don't have all the data we would like, but it sits at that 25 to 30% range. I think that's fair enough to say that. And then the question becomes, is that good? It does appear to be, but we're looking at 18 to 20% for everybody else. But comparing our data to everybody else's data at this point, it's a bit apples and oranges, right? So we arrived at those numbers through a certain approach. The 18% to 20% was a different approach, looking at slightly different cohorts and so on. So a really fair comparison is tricky, or it used to be. Luckily for me, in my postdoc, which has been really quite wonderful, is the medical schools outcome database has started releasing huge amounts of data about graduates. So that's really quite timely for me. Anyway, and this is a longitudinal tracking project. It's run by the medical deans, so medical deans of Australia and New Zealand. There are a couple of different components to this, but the first component was an exit survey graduates complete when they're finishing their degree. They say how old they are, how many children they have, different things about where they want to work, where they expect to work, how their experiences have been, so quite a lot of data there. And the nice thing is, it's the same survey at all medical schools for all cohorts, more or less the same survey. So it's really apples and apples at this point. And they have done a lot of work to link these registration data, these survey data to a registration data set. So the data set they chose was 2020, and it's probably taken them this long to get all those surveys linked. It's a lot of work. So there are problems just looking at 1 year of data, which they know about, and they are planning to add more years of data, which is really wonderful. And you can actually, if you're interested in workforce planning of medical graduates, you can jump on there and you can see how many female graduates are there working in these regions, how many graduates under this age or that age, or whatever. It's really quite amazing. I reckon it's the best tracking system in the world, so I think Australia is really sitting on a gold mine here, which is really hats off to the people who designed it. So if we use this data, it's much fairer, right? So the data was collected in the same way. We can say, well, everyone had the same thing, same approach. So if we look at all graduates, so at the bottom here, you can see the key, the dark blue, which is the dominant part of the bar, that's MM1. So if we look at all graduates, we can see a difference. If we look at Wollongong graduates, you can immediately see that there's fewer people in the MM1 regions. If we're looking at MM 2 to 7, which is obviously what we have been looking at, we can see that for the national average, about 18%. It was for this year, so that's pretty good. But for Wollongong, it's more like 29%, which was the higher end of the estimates I had for our own data, which is great news. And you can immediately see that that is a substantial difference. It really is. If you look at that with a relative risk model, you can say that a Wollongong graduate is 60% more likely to work in MM 2 to 7 regions than a graduate from the national cohort. So that's a substantial difference. I think that's really great. So in conclusion, Wollongong graduates, about 25 to 30%, and it's very variable, work in MM 2 to 7 regions, which is great. This is consistent across the career, which was, to me, quite surprising. And Wollongong graduates are about 60% more likely to work in MM 2 to 7 regions than graduates from the national cohort. So if you had to conclude, and I think it's fair to say this, that Wollongong's Graduate School of Medicine is addressing this health workforce need. It's producing doctors who are more likely to work in MM 2 to 7 regions. And I think hats off to all the people who have worked so hard to make that the case. So that's all from me. I'd just like to thank a few people before I go. The original Medical Dean's team, who are very forward-thinking in their design. The current Medical Dean's team, the UOW team, including the co-authors, and Lily, who does a lot of the data management, and our funders. So that's all from me.